The emergency room of St. Michael's Medical Center buzzed with its usual controlled chaos on that humid Tuesday afternoon. Nurses rushed between curtained bays, physicians barked orders, and the persistent beep of monitors created a symphony of organized urgency that had become the soundtrack of daily life in one of the nation's busiest trauma centers. Dr. Sarah Chen stood at the nurses' station, her white coat crisp and her stethoscope draped around her neck, reviewing patient charts on the computer terminal. At 28, she possessed a youthful appearance that consistently led people to underestimate her qualifications. Her petite frame, barely reaching 5'3", and delicate features made her look more like a medical student than a fully credentialed emergency medicine physician with specialized trauma training. "Excuse me, sweetheart," a gruff voice interrupted her concentration. Sarah looked up to find Dr. Marcus Webb, the senior attending who had been working at St. Michael's for nearly 2 decades, peering down at her with barely concealed condescension. "Could you grab me a coffee from the break room? 2 sugars? Light cream?" Sarah met his gaze evenly. "I'm reviewing Mrs. Patterson's labs, Dr. Webb. Perhaps you could ask one of the medical assistants." Webb's eyebrows rose in apparent surprise at her refusal. "Listen, rookie. I don't know how things worked at whatever small-town hospital you came from, but here we have a hierarchy. You're new, which means you help out where needed." "I'm not a rookie, Dr. Webb. I'm an attending physician, same as you," Sarah replied calmly, though her jaw tightened almost imperceptibly. "I started last week, but I've completed my residency and fellowship." A nurse passing by Jessica Martinez smirked at the exchange. She had worked with Webb long enough to know he enjoyed putting newcomers in their place, regardless of their credentials. "Don't take it personally, honey," Jessica said to Sarah, her tone dripping with false sympathy. "Dr. Webb just likes to make sure everyone knows their place around here. Maybe once you've proven yourself, you'll get more respect." Sarah returned her attention to the charts without responding, having learned long ago that some battles were not worth fighting. She had encountered this attitude before, would likely encounter it again. Her strategy had always been to let her work speak for itself. The afternoon shift continued with its relentless pace. A construction worker with a compound fracture, an elderly woman with chest pain, a teenager with a severe allergic reaction. The parade of human suffering never ceased. Through it all, Sarah worked with quiet efficiency, her movements precise and her decisions sound. Yet the subtle dismissals continued. When she suggested a different approach to treating a patient with suspected sepsis, Dr. Webb waved her off. "I've been doing this since before you were in high school, Dr. Chen. I think I know how to handle sepsis." When she asked to take the lead on a complex laceration repair, the senior resident, Tom Bradley, laughed. "Maybe you should observe a few more before trying the complicated ones. We can't afford mistakes here." Even some of the nurses, taking their cues from the established hierarchy, treated her with the kind of patient tolerance usually reserved for interns who did not yet know which end of the stethoscope to use. Sarah absorbed it all with outward grace, though inwardly she felt the familiar sting of being perpetually underestimated. It was nearly 6 in the evening when the emergency department's atmosphere shifted dramatically. The radio crackled to life with an urgency that made every head turn. "St. Michael's, this is Rescue 7. We have an incoming trauma, ETA 4 minutes. Male, approximately 60 years old, GSW to the chest and abdomen, BP dropping, respiration shallow. We're pushing fluids, but he's critical. Patient is insisting on St. Michael's, says he knows the facility." The trauma bay erupted into choreographed motion. Nurses prepped equipment, respiratory therapy stood ready with intubation supplies, and the surgical team received notification to stand by. Dr. Webb positioned himself at the head of the bay, as was his custom for major traumas. Sarah moved to assist, but Webb held up a hand. "Why don't you observe this one, Dr. Chen? Major traumas require experienced hands." Before Sarah could respond, the ambulance bay doors burst open. Paramedics rushed in, surrounding a gurney bearing a gray-haired man whose dress shirt was soaked crimson. Despite his obvious distress, there was something commanding about his bearing, even flat on his back and fighting for life. "On my count!" the lead paramedic called. 1, 2, 3. They transferred the patient to the trauma bay bed with practiced efficiency. Sarah caught a glimpse of the man's face, weathered, distinguished, with sharp blue eyes that remained alert despite his condition. Those eyes swept the room, taking in the assembled medical team with an assessment that seemed almost tactical in its precision. "Talk to me," Dr. Webb commanded, his hands already assessing the wounds. 2 gunshot wounds, the paramedic reported. 1 through and through to the right chest, possibly nicked the lung. 2nd to the upper left abdomen. Happened during a robbery at a convenience store. Patient tried to intervene. Witnesses say he moved like he had military training. The patient coughed, and blood flecked his lips. When he spoke, his voice was rough but carried an unmistakable authority. Chest tight, hard to breathe. "We're going to take care of you, sir," Dr. Webb assured him. "I'm Dr. Webb, the senior trauma physician. You're in good hands." Sarah had positioned herself near the patient's left side, her trained eyes assessing the abdominal wound. Something about it concerned her. The location, the amount of bleeding. "Dr. Webb, the abdominal wound. I think we need to consider immediate surgical intervention. The trajectory suggests possible splenic or hepatic involvement." Webb barely glanced her way. "Thank you, Dr. Chen, but I can assess the situation. Let's get imaging first." "There may not be time," Sarah pressed, her voice firm despite the dismissal. "His blood pressure is dropping, and that bleeding pattern—" "Dr. Chen," Webb interrupted, his tone sharp. "I said I've got this. Please step back and let the experienced team work." The patient's eyes, which had been drifting, suddenly focused on Sarah. He studied her face for a long moment, and something flickered in his expression. Recognition, perhaps, or surprise. His breathing became more labored, each inhale a visible struggle. Need, he gasped. "What do you need, sir?" Jessica asked, leaning closer. The patient's hand, surprisingly strong despite his condition, reached out and grasped Sarah's wrist. His grip was firm, demanding attention. "Colonel Chen?" The trauma bay went silent except for the beeping monitors. Every eye turned to Sarah, whose expression had shifted from professional concern to something more complex, a mixture of surprise and carefully controlled emotion. "Yes, General," she said quietly, her voice taking on a different quality, one of ingrained military bearing. "I'm here, sir." General Robert Harrison's bloodied lips curved into the faintest smile. "Recognized you. Good to see you, Colonel. Still, saving lives, I see." Dr. Webb's mouth fell open. "Colonel?" Sarah's attention remained fixed on the general, her hands already moving with renewed purpose. "General Harrison, I need you to stay with me. We're going to get you stabilized and into surgery." "Your assessment?" the general wheezed. "Truth. You need immediate surgery, sir. No time for imaging. That abdominal wound is critical." The general nodded slightly, then turned his gaze to Dr. Webb, and despite his weakened state, his voice carried command. "This woman is Colonel Sarah Chen, Army combat surgeon, 2 tours, Afghanistan, saved 37 soldiers, under fire at Kandahar, medals, classified missions. If she says immediate surgery, you do it. Now." The shocked silence that followed was broken only by the urgent beeping of the monitor showing the general's declining vitals. Dr. Webb stared at Sarah as if seeing her for the first time, his face cycling through emotions: disbelief, embarrassment, and dawning comprehension. Sarah did not waste time acknowledging the revelation. "Tom, call surgery now. Tell them we're coming up with a critical abdominal GSW, likely grade 4 liver laceration. Jessica, hang 2 more units of O negative and push the massive transfusion protocol. Dr. Webb, I need you to manage the airway. His oxygen saturation is dropping." This time, no one questioned her. The team sprang into action with renewed urgency, following her orders with the precision she commanded. Dr. Webb, to his credit, recovered from his shock quickly and moved to secure the general's airway, his movements efficient despite his clear discomfort. As they worked, Sarah's hands moved with the confidence of someone who had performed under far worse conditions than a well-equipped trauma bay. She established additional IV access, coordinated with the surgical team upstairs, and maintained a running assessment of the general's status, her voice calm and authoritative. "General, we're going to intubate you now," she explained, her hand briefly touching his shoulder, a gesture of comfort rather than medical necessity. "You'll be asleep, and when you wake up, this will all be over." The general's eyes found hers one more time. "Good to see you, Colonel. Still, the best. Rest now, sir. That's an order from your doctor." As the anesthesia took effect and the general's eyes closed, the surgical team arrived. Sarah provided a rapid, comprehensive briefing that demonstrated both her medical expertise and her military precision in communication. Within minutes, they were rushing toward the operating room, Sarah still coordinating care as they moved. It was only after the general had been wheeled into surgery and Sarah had given her final instructions to the surgical team that she returned to the trauma bay. The staff who remained stood in small clusters, whispering among themselves. When Sarah entered, the conversation stopped. Dr. Webb approached her, his earlier arrogance notably absent. Dr. Chen, I owe you an apology. Several, actually. Sarah's expression remained professionally neutral, though her eyes held a hint of steel. What you owe me, Dr. Webb, is the professional courtesy you should extend to any colleague, regardless of their appearance, age, or tenure at this facility. The General's revelation shouldn't change how you treat me or evaluate my medical judgment. You're right, Webb admitted, having the grace to look genuinely ashamed. I made assumptions, inexcusable ones. Jessica stepped forward, her earlier condescension replaced with something approaching awe. You really served in Afghanistan? As a surgeon? I did, Sarah confirmed simply. 2 deployments. But that's not relevant to my work here. What's relevant is that I'm qualified to do this job, and I've been qualified since the day I started, regardless of whether you knew my background. Tom, the senior resident who had laughed at her earlier, shook his head in disbelief. Combat surgeon, medals for classified missions, and we treated you like a green intern. You treated me the way people often treat women in medicine who don't look the part, Sarah corrected, her voice even but firm. The way they treat anyone who doesn't fit their preconceived notion of what a competent doctor should look like. My military service is impressive, yes, but I was a qualified attending physician before I ever put on a uniform, and I was a qualified attending physician when I walked into this hospital last week. The weight of her words settled over the group. Several staff members had the decency to look uncomfortable, recognizing the truth in her statement. The General, Dr. Webb asked, is he going to make it? Sarah's professional mask softened slightly. He's tough. The liver injury was significant, but we caught it in time. If I'd waited for imaging as you suggested, he likely would have bled out before reaching the OR. But he's in good hands now. Because you pushed for immediate intervention, Webb acknowledged, even when I dismissed you. Because I assessed the patient and made a clinical judgment based on my training and experience, Sarah countered, which is exactly what I should have been allowed to do from the beginning. Hours later, as the shift drew to a close, word came from surgery that General Harrison was out of the OR and stable. The surgical team reported that Sarah's rapid assessment had been exactly correct. A grade 4 liver laceration that would have been fatal without immediate intervention. Sarah was completing her charts when Dr. Webb approached her again, this time with 2 cups of coffee. Peace offering, he said, setting one beside her. 2 sugars, light cream. Figured if I'm going to ask someone to get me coffee, I should at least return the favor. Despite herself, Sarah smiled slightly. Thank you. Webb settled into the chair across from her. I've been thinking about what you said, about treating you differently because of how you look, your age, being new. You're right, and it's not the first time I've done it, if I'm honest with myself. No, Sarah agreed, and it won't be the last time someone does it to someone else, unless we all commit to being better. The General clearly holds you in high regard. Sarah's expression grew distant, memories flickering across her features. General Harrison commanded the base where I served during my 2nd deployment. There was an attack, a coordinated assault on our field hospital. We had dozens of wounded, including the General himself, operated for 18 hours straight under sporadic fire. He saw what military medical personnel are capable of under the worst possible circumstances. And after the military, I wanted to come home. Wanted to practice medicine somewhere I wasn't constantly wondering if the next explosion would collapse the tent around me. But the skills I learned, the ability to make critical decisions under pressure, to trust my judgment even when others doubt, that stayed with me. Webb nodded slowly. Those skills saved his life today. And they'll save many more lives here, if we're smart enough to listen. Over the following weeks, the dynamic at St. Michael's shifted noticeably. Word of the General's recovery spread, along with the story of the rookie doctor who turned out to be a decorated combat surgeon. But more importantly, Dr. Webb made good on his implicit promise to be better. He began introducing Sarah to other staff not as a new attending, but as a colleague with valuable expertise. He consulted her on complex cases. Most significantly, he used the incident as a teaching moment for the younger staff about the dangers of assumptions. The nurses, including Jessica, adjusted their attitudes as well. Jessica in particular seemed to have taken the lesson to heart, later confiding to Sarah that she had nearly become a doctor herself, but had been discouraged by mentors who suggested nursing was more appropriate for women. Seeing Sarah's competence and authority had rekindled something in her. General Harrison, once recovered enough for visitors, requested to see Sarah. She found him sitting up in his hospital bed, color returned to his face, the strong man she remembered from Afghanistan visible once again beneath the hospital gown. Colonel Chen, he greeted her warmly. Or should I say Dr. Chen now? Just Sarah is fine, General. Robert, then, since I'm currently a civilian in a hospital gown. He gestured for her to sit. I understand I caused quite a stir. You revealed information I hadn't shared with my colleagues. Regrets? Sarah considered the question carefully. No, though I wish it hadn't been necessary for my competence to be validated by someone else's recognition. I wish my credentials and performance had been enough. They should have been, Robert agreed. But sometimes, unfortunately, that's not how the world works. I hope I didn't make things more difficult for you. Actually, you made them easier, in the short term. But you also created an opportunity for important conversations about respect and assumptions in medicine. So perhaps it was necessary. Robert smiled, still turning every challenge into a learning opportunity. That's the Sarah Chen I remember. You know, I tell people about Kandahar sometimes. About the surgeon who worked calmly through an attack, who made impossible decisions with lives in the balance, who never lost her composure or her compassion. Some people don't believe me. They think I'm exaggerating. But I was there. I saw it. We all did what we had to do, sir. That's what service means. True. But some do it with exceptional skill and courage. You were always going to be an outstanding physician, Sarah, with or without the uniform. I'm just glad I was in your ER and not someone else's when that bullet found me. As Sarah left his room, she reflected on the strange turn her first few weeks at St. Michael's had taken. She had not wanted her military service to define her civilian practice, had not wanted to trade on her combat experience for respect that should have been freely given based on her qualifications. Yet here she was, finding that sometimes the armor we wear, whether literal or figurative, becomes part of our story, whether we wish it or not. The important thing, she decided, was what came next. The respect she had earned, whether through her performance or through the general's revelation, needed to be maintained through continued excellence. More than that, it needed to be extended to others who might face similar dismissal: the young residents, the female physicians, anyone who did not fit the expected mold. Dr. Marcus Webb had learned something valuable that day. So had the rest of the staff. But perhaps Sarah had learned something too, that while she could not control others' initial assumptions, she could control her response to them, and she could use those moments to create change. The rookie doctor they had mocked turned out to be a colonel, a combat surgeon, a decorated officer. But more importantly, she was exactly what she had claimed to be from the beginning: a fully qualified, highly competent physician who deserved respect based on her credentials and her performance, not on the revelation of a hidden identity. That truth, Sarah hoped, would outlast any dramatic rescue or powerful testimonial. That truth would be her legacy at St. Michael's Medical Center and anywhere else her career might take her.